Well, thank you, Speaker. My question is for the Minister of Health and Long-Term Care. In response to a question from the Liberal member from Cambridge, the Minister recently stated in the Legislature, "I'm proud that, in fact, under our government, every single Ontarian with diabetes who wants a family doctor has one." Would the Minister like to retract that statement?
Thank you. Minister of Health and Long-Term Care.
One person.
Well, Mr. Speaker, in a province with 13 million people, it is a challenge, of course, to constantly be able to provide every possible level of health care to every single individual at every single moment in time. But certainly, Mr. Speaker, the progress that we've made on our Ontario diabetes strategy is extraordinary. In fact, it's a model not just in Canada but around the world for the progress that it's made. And that objective that we have, that every single Ontarian who has diabetes, who wants a family doctor, has one, that objective stands, Mr. Speaker, and I'm motivated and want to work closely with the member opposite if he has identified an individual in the province where that's not the case.
Speaker, for some of my constituents who have diabetes are spending hours in the emergency room to receive the medical care they need. They could have told this minister that he was wrong. His comments show he's completely out of touch with the reality of the doctor shortage in Perth-Wellington. For 3 years, my office has received calls from those who desperately want and need a doctor. 2 weeks ago, we assisted a constituent with his diabetes assessment form from the MTO. He does not have a doctor and came to us for help with his medical paperwork. What does the minister have to say to him and others waiting for about a year on this government's Health Care Connect list?
Thank you.
Well, Mr. Speaker, we've come a long way in terms of providing a family doctor to those Ontarians who do want and need one. Mr. Speaker, I think the figure is 94%, and maybe within 1% of that, Mr. Speaker, but we've made an even more ambitious target in our platform that we're going to carry through with in the next several years, and that goal is that every Ontarian that wants a family doctor in this province will be entitled to one and will receive one, whether that's a family doctor or a nurse practitioner, but certainly that primary care provider that that individual wants and deserves, Mr. Speaker. So we have come a long way, I have to say, in terms of the provision of services, and in fact, Health Care Connect is an important part of that, where individuals who don't have a family doctor or a nurse practitioner or primary care provider can actually enroll with Health Care Connect, who works with them diligently to source and connect them with that individual that will provide them with health care services.
Question, the member from Essex.